Hi, this is our 2-minute warning for our broadcast partners. For our journalists in the digital room, we'd like to remind you that when the governor opens it up for questions, if you would like to ask one, you can click the Raise Your Hand button, and we will call on you, and then you will be able to unmute your own microphone and ask a question. Thank you.
Good afternoon. Earlier today, I extended Indiana's public health emergency order for another 30 days. This takes us to the beginning of May 3rd. Also, as I mentioned yesterday, on Monday, I will be signing another emergency order extending our Hunker Down Hoosiers, or our stay-at-home policy and order, for another 2 weeks. I think you'll better understand why we came to that conclusion here in just a few moments. And lastly, just a word of thanks. The President of the United States, President Trump, has just approved my request to declare a major disaster declaration for all of our 92 counties here in the state of Indiana. You'll hear a little bit more about that as well. So at this time, I'll turn it over to Dr. Chris Box, if you could give us an update on the curve and other items as well.
Thank you, Governor. I know that hearing bad news every day is really hard, and I hate starting my part of this broadcast every day with it, but it's imperative that Hoosiers understand the gravity which we're facing right now with COVID-19 across our state. Today, we unfortunately reached a milestone and surpassed 100 deaths from COVID-19 in our state. As we reported this number this morning, 24 Hoosiers have died from COVID-19. That is the highest number of deaths reported to date in a 24-hour period and reflects individuals who died between March 29th to April 2nd. This sadly brings the total number of lives lost in Indiana to this pandemic to 102. I had my team calculate what is truly a very crude mortality rate, which at the time is basically 2.9%, with the best data that we have available. What I want to make sure that you understand is that in Indiana, we have really done targeted testing only for our highest risk population, oftentimes really those individuals that were hospitalized. Those 80% of individuals that were sick, we just asked you to stay home and we didn't test. So consequently, this number is going to be much higher than the real mortality rate. We continue to hear that many of our patients who die of COVID-19 also have multiple underlying medical conditions such as heart disease, lung disease, or diabetes. Unfortunately, Indiana has a higher proportion of individuals who have these conditions as compared to other states, which makes obviously those individuals more likely to have severe illness or death from COVID-19. But as you can see, we're also seeing deaths occur even in some younger individuals, and that's why it is so important that we take these special precautions and stay home and social distance and reduce the risk that you will contract this disease or spread this disease in our state, in your family, in your community. As I've promised, we've added more data to our dashboard to better show not just the number of positive cases and deaths, but also the number of people who have been tested in each county across the state. While the percentages of those testing positive in some counties are higher than in others, it's important to remember that we continue to do targeted testing of those individuals who are at higher risk. I know this is a time when we're traditionally thinking about spring break, Easter gatherings, but I want Hoosiers to continue to take social distancing seriously. These are not normal times, and we cannot act as if they are. I know it's hard to think about missing a family gathering, but the best thing we can do to protect our loved ones is to follow the guidelines and flatten this curve as quickly as possible. The best way to keep from overwhelming our hospitals and our healthcare system is to keep people healthy. And we're still planning for when our healthcare system will experience the peak of that surge of COVID-19 patients. As we prepare for the peak of that surge, the National Guard is a critical partner in that planning. Thank you.
Thank you, Dr. Box, and that's a perfect segue to Adjutant General Dale Lyles, who will give us an update, a briefing on some of the ramped up activity that you'll see over the weekend as we head into this surge.
Thank you, Governor. I'm Brigadier General Dale Lyles, the Adjutant General for the Indiana National Guard. The Indiana National Guard continues to be actively engaged in the COVID-19 response. We are supporting Governor Holcomb's strategy to mitigate the COVID-19 virus. We are in support of the Indiana State Department of Health as we collectively work to flatten the curve and safeguard our fellow Hoosiers. Guardsmen are supporting communities all across the state, and our efforts include packing lunches and preparing meals at local food banks to be handed out in drive-through distributions, sorting medical supplies and PPE to be distributed throughout the state to those hospitals with the most urgent needs, augmenting staff and assisting in planning operations, supporting the State Emergency Operations Center, and utilizing our skills of future modeling and predictive analytics to advise the Governor's executive planning team. We are also supporting the Governor's surge planning efforts. We have established a site survey team led by Colonel Steve Hines, a seasoned combat engineer and current commander of the Indiana National Guard's 219th Engineer Brigade Combat Team. Tomorrow, Steve and his team will link up with members of the U.S. Army Corps of Engineers and Indiana State Department of Health and begin to conduct surveys and assessments of potential sites that could function as alternate care facilities. These initial assessments will evaluate sites across the state over the next few days. Considerations for alternate care facilities range from closed hospital wings to establishing hospitals in large-scale facilities. No specific locations have been determined at this time. The goal is to quickly assess and determine how best to expand Indiana's hospital bed capacity if needed. I'm very proud of the work our Guardsmen are doing, and we are proud to serve the Governor and our fellow Hoosiers, and we will continue to provide support to Hoosiers as needs arise.
Thank you. This next message that you're going to hear is one of the most important messages we're going to share throughout this whole ordeal. Dr. Sullivan's message, our message, goes out to those who may be infected, but those who may not be infected, but certainly affected by COVID-19 and the adverse ramifications that it's having on all of us. Her message, our message, is one of hope and help. And as we sail through this storm together, we want everyone to know that there are folks here who will deal with the troubles that maybe some are keeping inside. We want to work with you. And there's no better person to do that than Dr. Sullivan. And if you want to comment on some of the issues that are arising around the state and how we're reacting to them quickly.
Thank you, Governor. Good afternoon. I'm Dr. Jennifer Sullivan, Secretary of the Indiana Family and Social Services Administration. In addition to healthcare and social services, we oversee the Division of Mental Health and Addiction. Our team and incredible new leaders, Jay Chaudhry and Rachel Halleck, along with many, many partners across Indiana, have gone into overdrive to support Hoosiers in creative ways. Today, we're going to talk a little bit about what we know will be among the most crucial issues arising from the current crisis, the mental health and well-being of Hoosiers. We've seen some alarming statistics here in Indiana over the last few weeks that are indicative that our collective psyche is increasingly fragile. Gambling hotlines, which average 30 calls a month, have had 221 calls this week alone. Our addiction hotlines, which average 20 calls a week, are now averaging 20 a day. 2 agencies in Southwest Indiana have reported somewhere around a 50% increase in crisis calls. 211, which normally gets about 1,000 to 1,100 calls on a big day, has been getting up to 25,000 calls a day, many related to mental health and suicidal ideations. So while the bulk of our focus has rightly been on the heroic public health and healthcare efforts to combat this pandemic, there are 3 areas we would like to highlight that will be affected both during the current crisis and our recovery from it. And yes, there will be a recovery. First, we know that people that suffer from serious mental illness and children who suffer from serious and severe emotional disturbances are at higher risk of mental health crises. We've been working closely to provide maximum flexibility, including using telehealth, to our treatment providers to ensure that crucial services for this population can continue. They've responded with amazing creativity and innovation. The ability to access mental health services without barriers like transportation or standard office hours while still being able to maintain social distancing has been one of the highlights of this response thus far. We've learned that this type of access should be available to Hoosiers, public health crisis or not. Second, we know that many Hoosiers, even those that do not have a history of mental health diagnoses, are currently suffering from an increase in adverse mental health symptoms, caused not only by the social distancing that has disrupted so much of our daily lives, but also the uncertainty of the time to come. Normally, to the extent that anything in a disaster can be normal, in a disaster, the survivors suffer a terrible loss and then work to build back from it. This slowly unfolding, constantly changing, life and livelihood disrupting crisis is unlike anything we have ever seen and is going to cause many people to experience increased anxiety and depression. Our message to Hoosiers going through this is twofold. 1, it's normal to feel this way. And 2, help and help that works is available. If you find yourself experiencing these symptoms, please seek help. You can call 211, you can contact your insurance company to find access to teletherapy, and you can talk to your doctor about whether medication might be right for you during this time. Finally, and not at all without our notice, for those with substance use disorder, this can be an especially scary time. They say that the opposite of addiction is not sobriety, but connection. And it's very easy to be disconnected right now. However, we've been blown away by the resiliency and response of the treatment and recovery communities, and we've been honored to support them during this time. 12-Step and other groups have gone virtual. Residential substance use disorder providers and recovery residences have kept their doors open. Thanks to the quick work at the Division of Mental Health and Addiction and remarkable flexibility from our federal partners, access to life-saving medication-assisted treatment has been preserved in Indiana. I'd like to introduce you to one of Indiana's many experts in mental health, Dr. Ahmed from the Bowen Center. He would like to offer the state of Indiana an introductory telehealth appointment and offer some resources for all of us as we face the coming weeks together. Welcome, Dr. Ahmed.
Thank you, Governor Holcomb, Secretary Sullivan, and Jay Chaudhry from Division of Mental Health and Addiction for allowing us to continue effective patient care via telephonic services. My name is Dr. Ahmad, and I'm so happy that you have reached out to talk about the stress and anxiety that are feeling pretty overwhelming for you right now. First, I want to say that many people are experiencing significant increased anxiety and depression recently. This is a very normal response to being in such an uncertain time. Even people who are generally calm will feel worried when they're surrounded by so much uncertainty. For those of us who are already prone to anxiety, news of a disease outbreak can significantly increase the symptoms that we are already working to learn to manage. We might begin to worry whether we will be infected, whether our friends and families are safe, and how we will handle it if we ourselves or someone we love become ill. While some worries is absolutely normal in these circumstances, for some, the spike in anxiety may start to become so much overwhelming that it's become difficult to function. That's when it is important to reach out for help. First, let me ask you a few questions to see how these things are affecting your life. Are you spending most of your time feeling worried? Are you feeling you can't seem to control your worry, even though you are trying? Are you having panic-like symptoms, shortness of breath, chest pain, muscle tightness? Are you avoiding talking to your friends and family due to your worries? Are you having trouble falling and staying asleep due to these constant worries in your head? Are you feeling emotionally out of control or burnout? Have your family and friends started mentioning that they think your worries is getting out of control? Since you have said yes to several of these questions, it appears that seeking some help for your stress might help you feel better. The good news is there's a lot of options out there to help you. Some people feel a lot better when they're able to find a support group to manage their stress and anxiety. These could be online or organized via telehealth through a faith group or counseling center. Some people like to read self-help books to learn some technique that might help control their worries. Others find counseling with someone like me to be incredibly helpful. Therapists are highly trained to help people learn how to sort through their thoughts and organize them in a way they feel less overwhelming. Another option would be able to talk to a primary care doctor to see if non-addictive medication might help you feel less overwhelmed so that you can do things you need to do on a daily basis. You have the choice to participate in any of all these options. All of them are available through phone or internet, so you don't even have to leave your house. Community mental health center have many options for care. At the Bowen Center, where I work, I've been able to provide care via telephone. I can also prescribe medication and have it delivered directly to your door. Here are some things you can do at home that might be helpful. Make a list of things weighing on your mind. Circle the things you can control. And then list the top 3 things you can do to help move towards the more positive outcome. When you find yourself focusing on the worst possible outcome, force yourself to write down the best possible outcome as well. Tell yourself both are possible and that the reality is probably somewhere in the middle. Step away from your to-do list, if even for a moment, and know that being task-oriented has its place, but does not always have to take priority. Find an alternative, watching a television show, taking a walk, taking a shower, reading, calling a loved one, anything you can do to take your mind off the worries for a few minutes. If you're worried about basic needs for you and your family, call 211 to see what resources might exist to help. The future feels a lot less overwhelming when we have options. Give yourself a treat. This can be anything that you love, a dessert, a moment of quiet without your family present, permission to go to bed early, wake up early. Practice setting boundaries. Say no to helping others if you are struggling to stay afloat yourself. Move your body. Try at home workout with tons of free online options out there. Zumba, yoga, plyometric exercise are great to try at home. Thank you for reaching out to us. We are here to help you, support you, and to provide resources that will get you through this difficult time. Thank you so much.
Thank you, Dr. Ahmad. I made some notes for myself, and that all rings very true to, I think, everyone sitting at this table. Really appreciate you being part of today's delivery. Also, I just want to say before we get to taking some questions, today, just hearing this has been another blunt reminder of exactly why we are taking all the steps that we're taking, additional steps that we're taking, all in an effort to help slow the spread, obviously, of COVID-19. Dr. Box, as you heard, just reported our highest fatality over a 24-hour period from one day to the next. 24 families are still grieving. That's in addition to the 78 that still are as well that have passed before them. And these numbers, I think it's fair to say, it's a signal that we are at the start of this surge, but just the start of this surge. When you look at those charts and you look at the slope. So again, want to underscore just how incredibly important it is that we each, as Dr. Ahmad, as Dr. Sullivan, as Dr. Box have all said, that we're each taking care of one another, that we're each taking care of those who we love and those who we've never met to the best extent of our abilities. Because as we said just a couple days ago, we are all in this together. You and me, Jen, Chris, Dale, all of us are in this together, and we're going to get through this, and there is going to be reconstruction, and there is going to be recovery, and we're going to do it together. That starts with maybe things that seem small at the time, like washing your hands religiously. You've got me there. Quit counting. It starts with not just, just listening to this conversation, not just social distancing. We're still socially connected. We're physically distancing ourselves from one another. But we have to stay socially connected, but physically apart. And that's why when I hear stories about people going out every day and singing God Bless America around the flagpole, or if I hear church bells being rung at 10 a.m. every morning, showing that solidarity, showing our priorities. When I hear about, like up in Fort Wayne, where people are going out at 7 p.m. every day to wave at their neighbor, just to not just check on them, but maybe lift some spirits and say, do you need anything from across the street as we get through this together? This virus may be microscopic, but it is having an outsized, enormous impact on the world. And how we confront and overcome that is together through our contributions to getting through this together. And that's why it's just so invigorating again, energizing to see Hoosiers step forward. In South Bend, I read an article about a hotels plural actually, that are putting docs and nurses and medical professionals and the folks on the front lines so they don't have to go home. Maybe it's a distance issue or a safety issue with their family. Room and board, you talk about room in the inn. This is that story in real life today. You think about all the examples of our growers, our farmers, our restaurants who are taking food to hospitals directly so that folks who are missing meals because they're working shift after shift after shift, I don't know how they do it without dropping themselves, but they're focused on the patient. And for folks to take them nourishment, to help get them through the day, this is what's happening all over the state of Indiana. And speaking of song and speaking of front lines and law enforcement, we're having a little bit of fun along the way while we can. And the mayor of Evansville, Mayor Winnicky, sent me a video that was just put together by the Evansville Police Department. And the name of the song, there's a lot of songs out there that have a new meaning to them as we go through this. You hear a different message. maybe one that wasn't intended initially. But this song that the Evansville Police, the skit that they're doing is a song called Don't Stand So Close to Me by, you guessed it, the Police of Sting fame. And so these are some ways that we're getting through this together, lifting each other's spirits up. And the more we do this together, again, the faster and safer we will get through this, all of us. So thank you. And we're happy to, Rachel, open up the lines and take some questions.
We begin with Cameron Riddle, RTV6.
Sure. Hello, Cameron.
Hello, Governor. Good afternoon. The therapy that we just got was amazing. We enjoyed that here at the House. So thank you for doing that. I know a lot of people needed that. Couple of questions for Dr. Box. Can you explain when it comes to that total testing number, that the number of people tested does not equal people who tested negative? That could mean that you've either tested those people and they were just not positive that day, or you just haven't got the results. Because a lot of people are looking at the numbers and saying, oh, 16,000 were tested, but 3,000 are positive. That means 13,000 people don't have it. And that's not correct. And then earlier this week, I asked you a question about masks, and you gave a great answer saying the public doesn't need to wear masks because it's not practical. But that conversation continues to pop up more and more across the country. So how can we balance you saying that's not practical with these guys now saying, well, it's effective?
So very good question. And I watched the national news too and heard that they're leaning toward suggesting that everyone that goes out have a mask of some kind on. And I'm certainly not going to object to that. What I would ask is that you do not wear the N95 and surgical masks that our first responders and our healthcare personnel need so desperately. The second thing with regards to the data, we have been working very hard to make sure as every new lab comes on, as every new feed comes in from a new lab that's testing for us or an old lab that's doing a new test, that we get all of that fed into our data. So that's the problem, is that it just takes some time to get all that established.
Thank you, Cameron.
Rob Burgess, the Wabash Plain Dealer.
Hello, Rob.
Hey, Governor, how are you today?
Fantastic. How are you?
Great. So good to be with you again. Dr. Box, returning to the masks, yesterday the governor mentioned local teachers and administrators here in Wabash at the Heartland Career Center who were constructing masks. We also have a Facebook group here in Wabash that's dedicated to constructing their own masks after our local hospital put out a call for them. My question is, how effective are homemade masks? Is it possible many common fabrics that people might make to use these masks with are too porous to keep viruses out? And are there guidelines that you can offer the public who would like to construct their own masks at home?
Mm-hmm. That's an excellent question. You know, cloth masks tend to hold moisture better than other masks. So we oftentimes in medical personnel, we're looking for that moisture wicking barrier that prevents that, from settling into our mask and then being up close to our face. So ideally, if you can have something that has some, something that opposes the moisture getting in, that's what you want to have. But we do have people who are using the masks on the outside of, say, their N95 masks that they have to reuse over and over again to keep them from getting soiled. So they'll put the more colorful cloth masks there and then wash them.
Thank you, Rob.
Rich Nye, WTHR.
Hello, Rich.
Hi, Dr. Box, if you could just clarify a little bit where we're at in terms of positive test percentage and what that number tells us in regards to if we're only testing people who have symptoms or are on the front lines, is that percentage going to be naturally higher? What does that percentage tell us, if anything?
Well, I think what it tells us is that when we talk about targeted testing, that our healthcare providers are doing just that. They are testing our higher risk population, those individuals that are sick and those individuals that oftentimes are in the hospital. And so when we look at our targeted testing percentages, it's been traditionally anywhere from 13 to 15%. I think today's was actually up to like 17.8%. If you look at some of the around the United States, individual places that have had a large amount because they're a hot spot of testing and they do just average drive-through testing, that percentage is normally about 3 to 4%.
Jeff Smith, WLFI.
Hello, Jeff.
Hey, hello, Governor. Thanks again. Good to speak with you. Hey, I wanted to ask you about the legal basis, the constitutional basis for you issuing executive orders. We're hearing some people who claim that that's actually an unconstitutional action on your part.
To the contrary, I mean, we're happy to address any constitutional question specifically that they would have. And we've vetted this. Obviously, I'm not the only governor that's done this around the country, taken these actions, but they're all perfectly constitutional and the right actions to take, quite frankly.
Nikki Kelly, Fort Wayne Journal-Gazette.
Hi, Governor.
Hello, Nikki.
I was wondering if you could talk to me, or if Fred Payne is there. Several states are already sending out the $600 supplemental benefit for unemployment, but I understand Indiana's going to wait until May and was trying to figure out why.
Yeah. Fred's stepping up, Nikki.
Hi, Nikki. Good question. We've been issued specific guidance from the U.S. Department of Labor on how to handle those types of payments. And when I mentioned yesterday that we're looking toward May being the first part of the year, the first payments being made, that's straight from our direct communication with the U.S. Department of Labor and really talking to them and working through them with their guidelines.
Elizabeth, PBS Michiana.
Hello, Elizabeth.
Hello, Governor. I wanted to ask you about your announcement that the President has approved the disaster designation for all Indiana counties. What does that mean for us in practical terms?
Steve Cox is stepping up to the mic. He's with Homeland Security.
So my name's Steve Cox. I'm the Executive Director of the Indiana Department of Homeland Security. So on Monday, the Governor requested of the President to make the disaster declaration for all 92 counties. And basically what that amounts to is Indiana receiving public assistance money to the tune of about 75% of costs incurred by the governmental entities within Indiana in response to the COVID-19 crisis. We had requested individual assistance also, and the individual assistance piece is still under review. So there are still some outstanding pieces to that. So,
thank you, Steve. General, you want to talk about the Guard percentage?
So that declaration enables the Army National Guard and the Air National Guard to receive 100% reimbursement for the missions that we conduct in support of the strategy for fighting the COVID-19 mitigation. And so that allows us to put mission assignments together, run those through the Emergency Operations Center, get approved by FEMA, and then to receive that reimbursement in a very rapid fashion.
Thank you.
Lindsay Ardoti, the Indianapolis Business Journal.
Hello, Lindsay.
Hi, Governor. I have a couple of questions related to field hospitals. I'm curious if you guys can give an update on the homeless center that you guys had received the grant from the Lilly Endowment for. There's a story out that mentioned you might be using a Crown Plaza by the airport. And then I'm also curious whether or not there are any plans in the works to use the state fairgrounds as a field hospital. Kentucky has decided to go ahead and do that. So I'm curious if that's something you're thinking about.
I can address our homeless project, and then generally if you want to talk about field hospitals. We are thrilled to be safely hosting individuals experiencing homelessness and as they recover from the coronavirus. We are keeping the location of that particular facility here in Indianapolis to ourselves for their safety as they recover, but are so thrilled with the collaboration that's happened between multiple partners to make this project happen. We have active guests who are safe and comfortable and being fed and housed as they feel better, and then are also working with multiple different communities to replicate that process throughout the state.
As part of the surge strategy and working with the Department of Health, we've identified certain evaluation criteria to establish the so-called field hospitals, or alternate care sites as we prefer to call them. And we'll be seeking those site surveys over the course of the next few days in order to determine exactly what that looks like. Dr. Box and her team have identified potential surge areas, and that's where we'll start. And then we'll also look at areas that could potentially house that in a very rapid fashion that will give us the extra capacity that we need if we should need it in a surge environment.
Thank you.
Adam, WFIU.
Hello, Adam.
Hi, Governor. How are you?
Good, thank you.
Just a question. There was a report in the Indy Star yesterday that said there are a total of 5 COVID-19 cases in 2 correctional facilities, the Indiana Women's Prison, as well as the Plainfield Correctional Institution. I just wanted to make sure if that could be confirmed. Perfect.
Hi, Rob Carter, Indiana Department of Correction, and I've got my Chief Medical Officer, Dr. Kristen Doss.
Yes, that's true. We have 2 positive cases at Indiana Women's Prison and 3 positive cases at Plainfield Correctional Facility.
Sherry, the Indianapolis Star.
Yes. Hello, Sherry.
Hello, Governor. Hello, Dr. Spock Sullivan. I appreciate you taking my question. And this may be a question for both Governor Holcomb and Dr. Sullivan, especially because you're talking about all the messages of hope and help. We've seen national alcohol sales go up by 55% since the start of the outbreak. Does that, are you concerned about people developing reliance on alcohol or overusing that, sort of self-medicating? I also have another question for Dr. Box. If she could just give us an update on what percentage of ICU beds, are we still holding steady at about 40? Thank you.
Yeah, I'll speak very quickly and I'll turn it over to you and then we'll go to you. I'm concerned about that 365 days a year. And today is no different. And that's why I think it's critically important, and this will not be the first and last time you hear about our efforts to connect people with the help that they need during an unprecedented time like we find ourselves in right now.
Thank you, Governor, and thank you for that question. It's really important. Alcohol misuse and tobacco addiction remain our largest addiction disorders in the state of Indiana and across the country. And there's no greater example of that expanding than during a crisis like this. So all substance use disorders are a high priority for us. Alcohol is certainly notwithstanding. And we'll do everything that we can to continue to support people who are in recovery through that process with expanded access to telehealth, to virtual recovery centers, those 12-step programs that people rely on, but just in a different way than they normally experience them. And our recovery process is going to be incredibly critical for individuals that come out on the other side of this with either an exacerbated or a new substance use disorder.
And yes, Sherry, you're right. Our ICU beds are holding at about 40% that are available.
Kathy Treader, Ferdinand News.
Hello, Kathy.
Hello.
Thank you for, yes, we can hear you. Thank you for joining us.
Need to mute you. I still have a question about the numbers for Dr. Box, and it's something I'm so unclear of. That list of numbers that says they have been tested, and then the list of numbers that are positive, do a lot of the numbers up there that have been tested, are they still waiting results? Or are they negative for sure? I was told that earlier, and I just wanted to confirm that.
You are correct. All the numbers that we list there We have the numbers that have been tested, and then the numbers that we report as positive are positive. They're not pending results. Now, as we talk about individuals in the hospital, sometimes we talk about people that are taking up ICU beds that are pending the results. We're still waiting to find out if they're COVID-19 positive, and those that we know are COVID-19 positive.
Adam Wren, Indianapolis Monthly.
Hello, Adam.
Hey, Governor. I really appreciate you taking the time to do this each day. Just a quick question. Yesterday, the president's son-in-law, talking at a White House coronavirus task force, said that the notion of the federal stockpile wasn't supposed to be our stockpile. It's not supposed to be states' stockpile that they can use. Is that your understanding of the stockpile?
Always has been. You want to take that, Dr. Box? Yeah.
As a state, my understanding was that that strategic national stockpile stood there to help states at the time of need. I think that I understand that that stockpile was only so big, and it was really meant, as I said yesterday, and for a few cities, a few states to be having a disaster. When we have every state facing this disaster and needing the same equipment, the same personal protective equipment and ventilators, it becomes overwhelming, and there's no stockpile that was big enough for that.
Emma Kate, Chalkbeat.
Hello, Emma.
Hi. I wanted to ask, with school buildings closed for the rest of the academic year, what support is the state offering schools to get technology like devices and internet to students who need them?
Yeah, we'll continue to work every hour, every day, both our office and the SBOE, State Board of Education, with the Department of Education to make sure that, you know, if you find yourself in a remote or an e-learning situation, that that we're helping make those connections. And so this is something Dr. McCormick spoke on yesterday about. Each school is a little different, you know, the different percentages, 85 some percent, who are doing that e-learning, taking that route, but then there's some others that are doing remote. So Emma, it's a case by case, one size doesn't fit all, and we'll continue to work with the DOE specifically to make with specific schools to accommodate the route that they've chosen.
Larry Bemis, Park County Sentinel.
Hello, Larry.
Oh, sorry, didn't have the mic unmuted. Good afternoon, Governor. Good to see you.
Thank you. Thanks for joining us.
We do appreciate this opportunity every afternoon to chat face to face, those of us out in the boondocks. As I was listening yesterday afternoon, we in Park County had not had a positive test, and then in the middle of listening to the news conference, I got the notice that we had one positive. Then this morning, we got a news release saying we had a second positive, and our second positive in Virginia County, where I live. I've been told we may also have a third positive case pending here. One numbers that we haven't seen or heard, and I've heard through some sources, and Commissioner Carter talked to that here a moment ago, with the Rockville Correctional Facility, one of our biggest employers in the county. Word's going around that there may be as many as 6 inmates out there who have tested positive for the virus. I know that wasn't mentioned a minute or two ago, and it may just be rumor. Is there any confirmation of what's going on out there with that?
Thank you. No, that's not true. That we have no confirmed cases at Rockville. And Dr. Doss?
Yeah, I'm Dr. Doss. I'm Chief Medical Officer for Indiana Department of Correction. We don't have any confirmed cases at Rockville Correctional Facility. We continue to do not just COVID care and monitoring and surveillance, but also surveillance for all other things, common cold, influenza season still going. So we're monitoring all patients who are in our system and providing the best care possible. If I could just simply add, we are also encouraging hand washing, soap, cough hygiene, providing them with hand sanitizer, deep cleaning the facilities. So I can assure you we are doing all that we can for those we serve.
Dr. Box, you want to just speak to the fact that while you may have 0 today and then 1, 2, 3, 4, that's the whole point behind trying to flatten the curve and slow the spread.
Right. So the socially distancing part of this is that one person can infect, 2 or 3 people, then they infect each of them, those 2 or 3 people. Those numbers continue to grow. And if we just convince 1 or 2 of those people to socially distance, that whole column of people that would be infected does not become infected. And that's the incredibly important part of this. Also, can I just clarify one thing, Governor? I know everybody's really trying to get to this idea of what the negatives are, and I'm not trying to make this any harder than it is. We have 17,853 people, or 35 people that have been tested. Of those, 3,437 are positive. If you look at this, you can subtract and know we have at least that many negatives. I'm just saying that not everyone gets reported to us, so that's why I have a harder time giving you the total numbers of tested sometime. And then I'm even going beyond that to say, when we look at death rate and other things, there's a lot of people that 80% that I tell you that will get minimally sick with this stayed home and didn't get tested because of the limitations we had on testing.
Thank you, Dr. Boxon. Thank you, Larry.
Lauren Chapman, Indiana Public Broadcasting.
Good afternoon.
Lauren, we'll come back to you. Kayla Sullivan, Fox 59.
Hello, Kayla.
Hi, Governor. So my question for you, and then I also have a question for the IDOC. So my question for you is, why only extend the stay-at-home order 2 weeks? And are you planning on making the stay-at-home order any stricter? I know some states have limited the number of people that have been allowed to go into grocery stores. Are you considering any extra measures such as that? And then my question for the IDOC, is there a number of potential staff members, correctional officers that have been infected? And why are we limiting this to just local authorities to decide whether we should have inmates released for low-risk offenders?
You want to take the second one first, and then I'll come back to her first question?
Yes, I can confirm we have staff members that have tested positive.
How many?
Kayla, we've taken the 2-week approach because it gives us, we're more nimble to be able to address the executive order in its entirety and adjust, as I've said many times before, to the facts on the ground. We can go through line by line and tweak if we need to, and we don't have to wait a full month. And so while that public health emergency is 30 days, the hunker down portion of it is a 17-day period that has to do with answering questions like you've posed. So this is part of our review. There will be some tweaks to that specific executive order come Monday. So tune back in on Monday at 2:30.
Whitney Downard, CNHI.
Hello, Whitney.
Hello, Governor. I've actually got a couple follow-up questions. This format doesn't really make it easy for us to ask those. To Commissioner Payne, specifically, why can't Indiana give those additional $600 payments, and why can other states do that? And then for Dr. Box, we have these surge areas that you said you've identified. What are some of those areas outside of Marion County? And when will we learn what sites are specifically considered, such as the fairgrounds?
So on the first question about the $600 checks, again, we're strictly following the guidelines that have been laid out for us, so that we're working on with the U.S. Department of Labor. And I'm not really sure about what states have said that they're going to start paying very quickly. I'd like to really know those, but at any rate, we're really trying to make sure that we follow those guidelines so that we can ensure that the payments are made as quickly as possible without any hitches.
Eric Berman, WIBC.
Eric, just 1 second, please. You want to follow up on the other part of that question?
Right. Yeah. So first of all, with regards to other emerging sites, we've talked about the actual number of tests that are positive per population being higher down in southeastern Indiana. And we certainly have seen a surge or an increase on our border down there around Cincinnati and around the Louisville area and up around Ripley County. We also may be seeing some increases down in the southwestern part of our state that we're watching pretty closely. With regards to when you'll know more about those sites, we really want to do these site visits and look into this further to see which sites might be the most appropriate. And so we really don't want to talk about individual sites right now.
General, you want to comment on that as well?
Just to tap onto that. So along the I-74 corridor, we've noticed, that could be a potential area. Our teams will evaluate that, and I go back to Dr. Box has given us outstanding evaluation criteria to put against these potential sites. And one of the reasons that we're not as forthcoming with the locations yet is because we want to keep those close. They'll have close proximity to primary care facilities, good avenues of approach, good routes, and things like that.
Is Eric still on the line?
Yes. Eric Berman, WIBC.
Hello, Eric.
Bill here. Good afternoon, Governor. I had a similar question to Kayla's. A couple of local jurisdictions, not out of state, but in state, have gone more strict with their stay-home orders than the state order. Decatur has banned all restaurants from opening, not just carry-out only, but banning carry-out as well. Mayor Hogsett's order earlier this week said businesses could lose their essential designation if they don't take concrete social distancing steps. Are you okay with those steps at the local level, and are you looking at either of those among the tweaks that you described?
Yeah, to date I've been okay, but this is another reason why we do this in a 2-week increment so that we can adjust to what's happening around the state of Indiana. So come Monday, there may be some adjustments, not necessarily specific to these local decisions that are being made, but doing this in a 2-week period or increment allows us to adjust on the fly.
Abdul Hakim Shabazz, Indy Politics.
Hello, Abdul.
Hello, Governor. Good afternoon. You're my 2:30 viewing appointment. Congratulations. Question for you and for Dr. Box. And this kind of goes to the mental health issue that Dr. Sullivan talked about a few moments ago. With so much anxiety out there and so many folks on edge, and rightfully so, how do you and your administration deal with the misinformation or unsubstantiated information that just seems to be running rampant these days? Somebody talks about a New York doctor who cured 50 people with COVID, or when they do the counting, they're counting people who had COVID-19 but necessarily died from COVID-19. Like I said, it's just misinformation, unsubstantiated. How do you fight it? How do you deal with it so Indiana can do what it needs to do to deal with this address and get things back up to normal?
Yeah, I think everyone in this room could speak to how frustrating this is and how much time it takes away from our primary duties. It's become a collateral, very important duty for us all. This disinformation or misinformation, for whatever its motivation may be, is A, not appreciated, and B, is just contributing to the anxiety. There's nothing worse than having false hope from some false prophet that is trying to lead us down the wrong road here. So, like I said yesterday or a couple days before, get with the program, and one that directly deals with the truth on the ground. That's why we're asking you, when you're seeking information, go to those who are in authority, who have the best information. Verify it there. We are here for you. We are public servants, and we will not sleep to make sure that you get the answers that you deserve. But don't go out on your own and just, run down these rabbit holes and hold out hope for something that's never been proven. Steve, you want to pile on?
Yeah, the governor's 100% right. And one of the reasons that we do this press briefing every day is for us to be able to go ahead and get the correct information out there. Additionally, I will say our State Operations Center, Emergency Operations Center, along with the National Guard, we monitor social media. We look for this kind of misinformation, and we try to make sure that we put out the correct information associated with a lot of this stuff that's going on. The governor's 100% correct. The folks spreading this, all this does is it leads to people having more anxiety about this situation and everything else. And so we do everything that we possibly can to share the correct information out there.
Our final question is Alex from Bloomberg.
Hello, Alex.
Hello, Governor. Thanks so much for taking my question. I'm going to be doing some reporting in the next couple of weeks on tax incentives and specifically job retention tax credits across the country. I'm looking to see if your administration is looking to beef up incentives when we come back from the pandemic and what businesses will have available to them when they try to keep jobs.
Well, I expected to hear you were from Bloomington or another Bloomfield or not Bloomberg, but welcome. Thank you for joining us. Obviously, we're laser focused, squarely focused on the issue of the day. We went into this March on a roll. We were crushing it, economically speaking. We had 3 back-to-back-to-back record-breaking years here in the state of Indiana in terms of new job commitments, in terms of CapEx, a record high, in terms of all-time high wages. We are just a few thousand jobs shy of going over an all-time record in 3 years, what took others 4 years for new job commitments. I say all that just to kind of set the foundation for, we went into this storm in a record strong position because of our tax and our regulatory environment, and most importantly, because of our people, because of our workforce development programs. We are one of the most, if not the most nimble and realistic, adjusted states to the terrain, to the demands of the corporate sector. And we have aligned all of our workforce development efforts to meet those demands. And we'll return to that day. And all of that certainty, all of that continuity and predictability and stability that we offered going into this, when we take care of our mission here, we will quickly resume, and the world will know that once again, Indiana is a place of certainty. This is what Indiana's always done for 2 centuries plus. We have innovated, we have built, and we have grown our way to success. And we'll do it again because we're all in this together and we are one Indiana. Thank you all for joining us.
Thank you for joining today's media briefing. We will send a media advisory regarding the governor's next briefing.